You have seen a lot of figures, and my talk also contains a lot of figures. Therefore, I would like to go through very quickly and just to explain you how we try to get an overview and how different are the perspectives that we look on the field. But if you are interested in the details, Hans Zollner just told me that we can put our talks on the side of his institute, so you have access to a PDF of the slides, and then you can use it for your work. Yeah. So I will focus on the important things and to do a certain critique, also based on the literature and the experience from some model projects in Germany. One important sentence to start: childhood disability is both a risk and a result of maltreatment. In pediatrics, we have quite a lot of children that had been harmed very early by banging or other parental interventions. They end up with a huge restriction of participation and really severe developmental deficits. So often the cause is not in the data. So in the population of handicapped children, there are children that are handicapped because they have had survived an attack by parents or caregivers. We have some available data, you have seen that, and there's also data sets of good qualities, but we don't have them from all regions of the world. And we know, for example, that the legal systems in the United Kingdom, in the US and Canada or Australia are quite different, for example, from the legal system in my country. And legal systems frame the way we look on cases. You mentioned quite a lot UNICEF activities in your talk, Christine Weckerle, and I'm a member of the board of UNICEF in Germany, and this new classification of violence against children of UNICEF is not much used at the moment. And they included also homicide of a child into that classification, because when we look at the early ages, we have also these children that die from the hands of their parents. And that's also part of the violence against children that we have to look at. And the children that survive these attacks often are handicapped for their lives. So if we look from a medical perspective, the doctors often don't speak of handicap, they speak of a chronic disease. And some data you will find in statistics on chronic diseases. Yeah? And if we look at that population, I brought you these figures just to show you what Baroness Hollins, what Sheila Hollins said here at the first day. It's not minority. If you look at that perspective, yeah, it's a huge group. Yeah? So it's not an issue of minority, but we are talking about a huge group. And there are these diseases like asthma that do not so much restrain participation. Yeah? But there are other diseases who have high impact. And Christine Weckerle showed you that busy slide with the different fields. The way we deal with these groups also influences their risk. Because, for example, children with asthma and malnutrition in the 50s in Germany had been sent during their vacation to institutions, also of the Catholic Church, and had been sent there to deal better with their diseases, but finally ended up being abused in these institutions and got harm and traumatic impact in this setting. These settings are now over, so it depends on the way we deal with a disorder in society. Children with epilepsy have often difficult needs of care and are often placed in institutions and are a subgroup of high risk, and it's absolutely under-researched. There's plenty of research in children with diabetes, and we, to my knowledge, don't have any knowledge about increased numbers of abuse in this group. So you see that the frame of chronic disease in some way leads us to different kinds of risk of maltreatment or abuse. And if we go to German figures, we have a health survey, and in this health survey, they say that 16% of the German population of children has at least one chronic disorder. And the most common diseases are obstructive bronchitis, the whole allergic spectrum, but you have very different sorts of disorders, and you have the specialists. And usually they have very much confidence in these specialists, but these specialists that often see these children often are not trained in child protection. Yeah? So,
or child maltreatment at all.
Yeah. So that's, I think, an issue. And if you look at UNICEF data or the global burden of disease data, it's just to show you again that's a huge number of patients suffering from disorders, and that we have to train the medical field in the issues of child maltreatment and child protection. We can't wait for specialists because we need the people who refer them to specialists. And if we look at global and regional prevalences of disabilities, we see, and I will not go into to the details, that we have a big variance between countries. And in sub-Saharan Africa and South Asia, these regions accounted for more than half of the children with disabilities. And this has to do with the economic situation and the situation of poverty and the lack of access to medical care in the early childhood. So we also have a political and socio-political dimension. In Germany, the number, according to our social laws, is quite low, with 1.5%. And in our laws, we distinguish chronically ill children, children with special care needs, children with strong limitations in daily life, and children with severe disabilities. And there are different support systems, and you have to train every system on child protection, yeah? Because the institutions are organized in these different care systems. This is a more practical view on that. We have children with multiple disabilities, because often these children have to cope with different problems in their life. We have children who have primarily intellectual disabilities, and we have seen quite a lot of data on these children. We have children with primarily physical disabilities, and they are often taken care of in a completely different context. And we have children with other chronic physical illnesses. And apparently the less severely disabled with respect to participation in our society are the children that are more affected by abuse, because there are more uncontrolled situations where a caregiver, for example, or a peer can abuse a child. Perhaps in the situation of severely handicapped, multiple disabled children, there is perhaps less abuse, or we have less data because they can't speak about it. Yeah? But if you look at the data, we have less data about that group. And if we compare it with the blue group, children with behavioral issues, so my clientele as a child and adolescent psychiatrist has an especially high risk of being abused. Physical abuse, emotional abuse, and sexual abuse. And medical neglect is a special form of abuse in a subpopulation of children that needs medical care permanently. And often it is not spoken of it as a form of abuse. So if we look at the risk factors, we have risk factors in the parents, and in the literature we have quite good indication what causes a higher risk for a child to be abused. We have risks in the children. Oops, there I still have the German text of that slide. So if you have, we will change that in the document. You have the young age of the child, then twins and multiple pregnancies, children with behavioral disorders, and we have risk in the environment, as I already told you. Here we have it now, sorry. So the risk factors are, and that's an important slide, dependence from caregivers, lack of privacy, social isolation, communication barriers. We heard a lot of that the other day when you informed us about deaf culture, limited physical abilities, and lack of choice. If you have to rely on a translator, the translator is in a key role and he can abuse you. Yeah? You explained that to us. And by the way, I would like to thank the translators. They do a fantastic job bringing us together, and it's an important work. Perhaps we have an applause for them. So if we look again at numbers, we have a 3 to 7 fold increase of abuse and neglect for children with disabilities. In the US, we have numbers that 14% of all children affected by abuse and neglect have a disability. So it's from a statistic on abuse and neglect, you look at the part of children with disabilities. And we have an increased risk, a twofold risk for children with chronic illnesses. And this is replicated in many studies. You have seen the data already. And if we go to a general comparison, I find that paper from Sullivan and Knudsen that looked to a child protection sample of 40,211 children, a general sample. They found a huge difference in the children with disability. About a third had experience of abuse, and in the children without disability, 9%. So it shows the dimension. And the main findings were that there is that increased risk, and children with behavioral problems are especially affected. because they need special care situations, and often they create situations that are difficult to handle for the adults. And now these are very, very busy slides. And just to show you how in science we try to get an overview in many studies, we call this a meta-analysis. And if we look at these slides, you have that long line in the middle that shows the zero line. If data are on this line, there is no increased risk. And if the results and the confidence intervals are beyond that line, be it on the right side or the left side, you have a significantly decreased or increased risk. And what you can see here on that slide is that almost all studies show an increased risk, a significantly increased risk for children with disability. So you don't know to have the detailed data, you just can say that about 3.6, there's a 3.6-fold increase of risk for that population for any form of violence. For physical abuse, 3.5, for sexual violence, 2.8, so nearly a threefold risk. Yeah? And that's the important message. Children with disabilities are much more likely to be abused. And therefore, we have to look for special offers for that high-risk situation. Neglect is the most common form of abuse, together with emotional abuse, which is also quite frequent and often not seen or observed. And these children are also prone to neglect in the parental environment and also in the institutional environment. So we also have to look at that. And if we look at sexual violence, I brought you some data also from Germany, where you can see that they have a 2 to 3 times higher risk as the meta-analysis had shown you. And there is another meta-analysis that shows just the risk for sexual abuse depending on different variables. And now you can read these figures just seeing the optical impression you have when you see there are highly increased risks. And you have changes depending on the type of disability. So you can really look into a big number of data to find a picture. Now I will come to more practical things, but just to summarize what we both said, there is an increased risk, so we have to take special action and we have to focus on that. And you already mentioned the classification of the WHO and also the Convention on the Rights of Persons with Disabilities. And there are 5 approaches to an inclusive society: raising awareness, looking at living spaces and inclusion in the normal society, accessibility of services, individualization and diversity, and finally, participation. So, my first experiences of a research project with participation of people with light intellectual disability was when I was at Rostock in the Baltic Sea. And we did focus group interviews in institutions because the normal care system didn't reach these persons. So we had to go to the institutions. And with the results, we did the first congress in Germany in easy language with translators, with focus groups, and we had people with intellectual disability from all over Germany at that Congress in a huge Congress hall. And it was difficult to get money for it because the scientific sponsor said that's not science. Yeah, it's practical work, it's social work, yeah, at that time. Yeah? But it proved it was extremely helpful. And finally, we could publish a book on that. We published an article series. So just to tell you, it's only some years ago, these forms that we now think are very, very important with participative approaches were very far away. We developed 2 textbooks on sex education and self-protection in the sexual field for people with intellectual disability. And I already told you about the research design. And we developed many evaluated materials that are still used in Germany until now. But on the other side, the same group, I left Rostock, went to Ulm, but the same group in Rostock performed a clinical trial with role plays and information of children with light intellectual disability, and they could show that the transfer from role play situations to real-world situations that were also simulated didn't function. So really, we do not need only good intentions. We have to evaluate our approaches and to find out whether a learning from material or from a group session to a real-world situation is feasible. And for me, the consequence of this is to say that bystanders, that the persons around a child and that know a child and that observe a child are much more important in that field. And they have a crucial role for prevention. So if we look at the concepts of prevention, we have now in the legislation in Germany an obligation of the service providers in that field to have some sort of violence protection of safeguarding concepts. So that's in the law, and I think that's a big progress. And there should be a barrier-free access to complaints procedures, because often, like the dioceses in Germany, there is a telephone of a lawyer where you can complain if there's a problem with the Catholic Church, with a priest or an institution. But that's not accessible. That's too high level, yeah, for many in this population. So we really have to promote active participation and empowerment and create in the institutions more space for privacy and intimacy and an access to really talks in private situations. It's important to inform them about their rights, that they have rights in institutionalized care, and to raise awareness for humiliation, for the power differences in these institutions, because it's often part of the daily life. And the German Child and Youth Strengthening Act also says that our youth services are responsible for everything what is going on in the disabled field, because before that was separate and child protection measures only applied for the youth institutions with so-called normal children. Yeah? So we often have these different columns in our social systems and no cooperation. And this leads to quite a lot of conflicts in that field because you have so many different administrative responsibilities. And the responsibility for child protection is in another institution than the care for that subpopulation. And that can't work in the end. So we had in Germany this round table that Hans mentioned in 2010. And there we defined that an institution have to be a safe place, and we need prevention concepts for that. But the institution also has to be a center of competence. Yeah? The people working in the institution has to be a center of competence for child protection, because we have a higher number of abused children in these institutions. And this busy slide I explained to you last year, I just wanted to focus that we have different levels of prevention. And when we talk today on children with disabilities, we talk on prevention for particularly vulnerable groups, so some sort of selective prevention. And there we can focus on the micro level, on the personal background, and also on the society level. We have to take many measures, as I told you, because the legal definitions create the consequences we have in that field. For the children, it's important that they become voice, that they can be heard, that they become choices. They can choose whether they want to live in a certain environment, and that they can leave situations that are unsupportable for them. And we have now in all clinics in Germany an obligation to have safeguarding process, and I'm very proud about this. And every institution has to have prevention measures, an intervention plan, and reviews of situations where something happened. We have new projects in Germany, the BEST project, with material for young people, Ben and Stella, what to do about sexual abuse, and with a lot of information. There is a huge dissemination of that, but finally there is no evaluation of it. We have exhibitions, we have other interventions, but no evaluation. And as this is the research day, it's just to say we have to evaluate the things we are doing in that field. So I come to my conclusion. And this is a poster from a campaign of the German government. I think children with and adults with disabilities have a significantly increased risk for all forms of abuse. And why the worldwide context of the Roman Catholic Church is so important is that the Roman Catholic Church, on a worldwide perspective, is the biggest provider of medical care with hospitals worldwide, and is the most important provider of institutional care in homes for chronically ill people with disabilities, children with disabilities, and elderly. So for all these populations that need special support. Awareness is not enough, it's important. But we have to understand the different cultural background, as you explained us in that wonderful session. And we have to reflect about the asylum structure of many institutions and the barriers that it brings with them. And we have to have risk-adapted concepts in protection of minors. And therefore, we have to evaluate the individual risk in these institutions. And then we can really comply with these general principles of the UN Convention. And one thing we discussed the other day is when Sheila Hollands showed their picture stories, and I said in Germany, you couldn't go to court with this. We have to have a legal system that allows these children to have access to the legal system. And this is very difficult for many persons with disabilities. So Sheila Hollands talked about belonging, and we have an initiative in Germany that I founded that means belonging, dazugehören. And it's about inclusion. And as we are in times of soccer, I translated some American slides with a baseball background to a soccer metaphor. And you see here only the boy can watch the game. And often in schools we say we need equal support for every child. But that notion of equality does not help. We really have to look at the individual needs of children if we want to give them assistance. But finally, this is not what the convention is about. The convention is not about this. The convention is about creating an environment that allows every child to participate, and in our case, to seek help. I thank you very much for your attention.